think it's the field that I felt I could reach out and touch patients and get them through treatment the most. I really connected with the patients in oncology. And regardless of the prognosis, regardless of anything that's going on, there's some patients that we can cure, but even the ones we can't, I felt I could help them a lot. You know, there was always ways to help somebody in oncology, and I was really drawn to that. One of the reasons why I chose this field is because it's ever changing, and I like to be learning new things all the time and always find ways to help patients. And I always feel that there's a piece of hope for every patient because I know that there's something around the corner. Our understanding of the immune system is growing, and how the immune system can recognize and attack cancer is improving. And we basically we are now able to find ways to unlock the immune system's ability to go after cancer. And we're seeing some longer survivals in diseases such as melanoma and lung cancer, and the list is getting longer about where this is becoming effective. And the duration and responses are amazing, and actually the toxicity is pretty manageable compared to some of our older classic chemotherapy regimens. So yes, that's sort of the source of all the excitement, is that kind of a response with less toxicity and potential for durable long-term responders. And now we can sequence the entire tumor and look at the entire genetic sequence of the tumor, and we're starting to find that certain driver mutations in these cancers are maybe the one thing that we can go after, and with a smart bomb approach, we can take a drug and maybe go right after that and leave some less collateral damage for the patient and less side effects for the patient, and really go after the heart of the matter and that's driving the tumor. And that's also exploding as far as options there. So another area to be very excited about. When patients come, I think part of what they're looking for is that connection with their doctor. I hope that they can walk away with not only a connection with me, but also sort of a connection to what their next phase of life is going to be like, and understand a little bit more. And I very much pride education as part of our goals of care. And I spend a lot of time on education. I draw on the dry erase board in my room. And I want them to walk away with a full understanding as much as possible of their disease, what's going to happen next, and understand why we're going to make the decisions we're going to make. I think the biggest fear in most of this is the unknown. So even if the news that we deliver is bad, if it's clear to people about what the next few days, weeks, or months are going to be like, I think it helps them sort of adapt to what's going on and understand their process. And I think, again, that unknown kind of goes away, and then it's easier to go forward.